So when should you refer to a cardiologist? Well, a referral to cardiologist should be considered if anyone has 3 or more risk factors for cardiovascular disease, so that increased waist circumference, increased triglycerides, or low HDL, increased fasting blood glucose or hemoglobin A1C, lack of exercise, and particularly because it can be so hard to pick up cardiac disease in this patient population. It's harder to get exercise tests. You may be able to do a modified exercise test with an arm ergometer. You may be able to get a modified exercise test, but often if we're actually going to check, we have to go to something like a MIBI test to try to check for any cardiovascular dysfunction, or we can try to check for vascular calcification with the vascular calcification scores. Again, we don't know norms in the spinal cord injured population versus the general population, but I would just go with the current general population norms. Using those as cardiac tests can be effective, but I think it's particularly important in this patient population because of the fact that they may present unusually or tend to present with delayed symptoms of cardiac disease, to be sending them to cardiology earlier than you might with someone else, because as I said, they may not present with typical angina. When to refer to a dietitian or a nutritionist? I think everybody should probably get a referral. If they've come through GF Strong, they've probably met with the dietitian and the nutritionist, but that may have been 5 years ago, 10 years ago, 15 years ago, 20 years ago. Their diet may have changed over time, their needs may have changed over time. So if you can access a dietitian or a nutritionist, particularly someone who has familiarity with spinal cord injury, I think that's a very useful intervention, and patients are usually very open to that. They're looking for help and recommendations. Exercise or rehab professionals, again, if you can find somebody who has expertise in working with spinal cord injury or neurologic disabilities, whether it's working with a personal trainer who's got some expertise, a kinesiologist, a physiotherapist, an exercise specialist, but somebody who's got some of that expertise, because we do want to adjust and be thinking about how people, be thinking about those overuse injuries I talked about, be thinking about their skin, be thinking about preserving their shoulders and not overdoing things while we're getting them stronger and fitter.